Recurrent pyogenic cholangitis, RPC, comprehensive overview. Definition: recurrent pyogenic cholangitis, RPC, also known as Oriental cholangiohepatitis or Hong Kong disease, is a chronic biliary disorder characterized by recurrent episodes of bacterial cholangitis, intrahepatic bile duct strictures, and formation of hepatolithiasis, intrahepatic bile stones. It primarily affects individuals in East and Southeast Asia. Causes: 1. Primary etiological factors. Infections. Recurrent bacterial infections, predominantly by Escherichia coli, Klebsiella, Proteus, or Enterococcus. Parasitic infections, liver flukes, Clonorchis sinensis, Opisthochus viverrini, and Ascaris lumbricoides. 2. Secondary factors. Bile stasis due to anatomical abnormalities like bile duct strictures or stenosis. Malnutrition and low-fat diets leading to poor bile drainage. Genetic predisposition in affected populations. 3. Environmental factors. Contaminated water or uncooked fish, reservoir for liver flukes. HAT types, pathological stages. 1. Acute stage. Inflammation and infection dominate with bile duct obstruction. 2. Chronic stage. Strictures, fibrosis, and hepatolithiasis occur. 3. Complicated stage. Progression to biliary cirrhosis, liver abscess, or cholangiocarcinoma. Symptoms. 1. Acute presentation. Charcot's triad. Fever, jaundice, and right upper quadrant Q pain. Chills, rigors, nausea, and vomiting. 2. Chronic presentation. Recurrent episodes of RUQ pain and intermittent jaundice. Malabsorption and weight loss due to recurrent infections. Signs: hepatomegaly and tenderness in RUQ. Severe cases: ascites or palpable mass in advanced cholangiocarcinoma. Complications: 1. Hepatolithiasis leading to biliary obstruction. 2. Liver abscess formation. 3. Secondary biliary cirrhosis. 4. Increased risk of cholangiocarcinoma. 5. Sepsis from recurrent infections. Investigations. 1. Blood tests. Elevated white blood cell WBC count indicating infection. Liver function tests. Elevated bilirubin, alkaline phosphatase ALP, and gamma-glutamyl transferase GGT. 2. Imaging studies. Ultrasound identifies bile duct dilation and stones. Magnetic resonance cholangiopancreatography, MRCP, non-invasive evaluation of biliary strictures and stones. CT scan, useful for identifying complications like liver abscesses. Endoscopic retrograde cholangiopancreatography, ERCP, both diagnostic and therapeutic for bile duct strictures and stone removal. 3. Microbiological studies, bile culture for identifying causative organisms. 4. Histopathology, biopsy if cholangiocarcinoma is suspected. Treatment. 1. Medical management. Antibiotics. Broad-spectrum antibiotics covering gram-negative and anaerobic organisms, e.g. ceftriaxone plus metronidazole. Supportive care. Intravenous fluids, analgesics, and management of sepsis. 2. Endoscopic or surgical interventions. ERCP. Removal of bile duct stones, dilation of strictures, and stent placement. Surgical approaches. Hepaticojejunostomy for biliary strictures. Hepatectomy for segmental biliary disease or recurrent stones. 3. Adjunctive therapies. Ursodeoxycholic acid to improve bile flow and prevent further stone formation. Biliary drainage procedures. External or internal drainage to relieve obstruction. Recent advances. 1. Advanced imaging, diffusion-weighted MRCP for better visualization of biliary anatomy. 2. Endoscopic innovations. Spyglass cholangioscopy system, direct visualization of bile ducts for precise diagnosis and treatment. Laser lithotripsy for breaking down large stones during ERCP. 3. Minimally invasive surgery, laparoscopic approaches for stone removal and bile duct reconstruction. 4. Antibiotic stewardship, emergence of pathogen-specific antibiotic regimens based on regional microbial resistance patterns. 5. Genomic insights, genetic markers associated with predisposition to RPC, aiding in early diagnosis and family screening. Prognosis. With early diagnosis and appropriate treatment, RPC can be managed effectively. However, untreated or recurrent cases may lead to severe complications, such as biliary cirrhosis or cholangiocarcinoma, necessitating long-term follow-up.